Hello, everyone, and welcome to the fourth annual New Jersey Youth Transition Conference. My name is Amy Yedley, and I work for Values into Action as the Director of Projects and Innovation. We are thrilled to have you joining us today. It is my honor to introduce our next speaker, Paul Aronsohn, a dedicated advocate and leader in the disability community. As the Ombudsman for individuals with intellectual or developmental disabilities and their families in New Jersey, Paul has spent years championing the rights and needs of those who navigate the often complex systems of support and care. In alignment with this year's theme of the hero's journey, Paul will guide us through the challenges, triumphs, and transformations that define the paths of many people with disabilities and their families. His deep understanding and unwavering commitment make him the perfect person to speak to the unique journeys we all undertake in this space. Please join me in giving a warm welcome to Paul Aronsohn, whom many of us know as a superhero in our community. Paul, the floor is yours.
Wow, thank you. Thanks so much, Amy. That was very nice of you, very kind of you. It's great to be here. Thanks for inviting me back. Thanks to you and April and everyone who puts this together every year. I really appreciate the opportunity because it's such an important topic, and it's a great opportunity for all of us, those who are presenting as well as those in the audience, to sort of learn a little bit more, engage each other, and do what we can to sort of move this topic forward. So what we thought we would do is talk about our office. Some of you probably are familiar with our office. Some of you are not. So I'll just give you a quick overview. And then speaking to the topic at hand, how our office serves as a bridge through the transition process, how we work with individuals and families during that all-important sort of years of transition to work through the issues. So first of all, again, my name is Paul Aronsohn. I am New Jersey's Ombudsman for individuals with intellectual or developmental disabilities and their families. It's a relatively new position, relatively new office. It was created just under 7 years ago by the New Jersey State Legislature in December 2018. Our office, the legislation for the office was signed into law by Governor Chris Christie in January of 2018. And I was appointed by Governor Phil Murphy as New Jersey's first ombudsman in April of 2018. So we've been sort of operational. I've been on the job for about 6.5 years. And it's been an extraordinary experience. I'm someone who, like a lot of folks who work in this space, I come with lived disability experience. I grew up in a family with disability, and so this is a passion of mine. And so to be able to be in a position like this and to work with individuals and families across our state is just a wonderful gift for me. The office was born out of the recognition that here in New Jersey, we have a lot of resources, both in absolute and relative terms, relative to other states, for children as well as adults. But as I'm sure all of you know, as we all know, it's a complex system to navigate. We're talking about working through lifelong disabilities. And so sometimes you'll get through today's challenge, but tomorrow you'll have another set of challenges. And the folks in the legislature, listen to the families who advocated for an office like this and put it together so we could be a resource, first and foremost, for individuals and families. We work, again, with children as well as adults and their family members, parents, siblings, uncles, aunts, you name it, friends. The legislation that created the office sort of outlined a set of responsibilities, but we've put it into 3 buckets. First and foremost, we work daily to sort of connect individuals and families to the programs, the services, the supports that exist. We help them navigate the system, trying to make sure they get those services and supports that they not only need, but that they deserve. And again, that's true for children, adults, as well as families. Second, very importantly, we work with the individuals and families, as well as our colleagues throughout state government, to try to improve the system of care for people with disabilities, to make it stronger, better, to make it more user-friendly and more accessible, and ultimately to make it more person-centered. And third, and very importantly, we work daily with individuals and families to help make sure that their voice is heard, and heard in a meaningful way on issues that are directly important to them, but also, again, in that larger policy discussion that takes place in Trenton and throughout our state. We take a very personal approach to our work. I spend most of my day on the phone or in video meetings, or whenever possible, meeting with individuals and families in person. And we don't invite people to our office. We take our office to you, and we meet with folks in their homes, in their schools, in their places of employment, in their communities. We travel the state meeting with advocates and trying to, attend any event and try to sort of connect with people, again, in a very direct, personal way, which we think is more meaningful. It not only helps us to help individuals and families better by talking face to face, but being in their homes, being in their workplaces and schools, we get a better understanding of the challenges as well as the opportunities that families facing. We get to meet siblings and other family members and friends. And it helps us not only to help that individual and family, but also, helps us to understand, on a larger level, the challenges and opportunities faced by people with disabilities and their families. As you can imagine, perhaps, we work on every issue imaginable. People come to us, with issues ranging from housing and employment and education and transportation to access to healthcare, to criminal justice. You name it, we work with individuals and families on it. And while we're not in a position to make policies or overturn decisions, we're in a position to sort of help get information, which can be very valuable for individuals and families, and help them sort of brainstorm and strategize and advocate and find their way through some challenges. So not surprisingly, because we work with children and because we work with adults and families, not surprising that we spend a lot of our time working through transition issues. It's a big part of our portfolio. And not just because of, again, we have a foot in both the children and adult world, but also because, as you all know, transition issues are among some of the most important issues. They're the issues that affect every individual with a disability and their families. And it's a very complex set of issues. As you've talked to me, I know you've heard from some of my colleagues in state government, as well as most recently from SPAN. It's transitioning from high school into maybe higher education or maybe into an employment environment. But it's even more, intricate than that. And what I mean by that is it involves, moving, on healthcare from access from your pediatrician who knows your child, has worked with your child and your family for so many years. Now going to the adult world and having to find a new primary care physician, a new set of specialists, a new dentist. It's working through issues like legal status from supportive decision-making and power of attorney to guardianship. It's understanding some of the programs, federal and state, that are available to individuals and families, from 18 and above, Social Security, Medicaid, in some cases, Medicare. It's understanding transportation, thinking about transportation a little differently. The school bus no longer shows up after age 21. What does access to the community look like? Access to an employment, access to a day program. What is transportation? New Jersey Transit, Access Link, county transportation. So we work with individuals and families on this whole range of issues. And again, we don't always have the answer. We don't always, aren't able to sort of, make policy, but we're in a position to work closely with individuals and families to help you get the answers that you need so you can make the right decision. We've spoken about transitions in our I have to do an annual report to go to the governor. And we've spoken about transitions in each of our reports, I believe. I remember the first report for the year 2018, identifying transitions as a key topic that needed to be sort of understood a little better. And, over the time, our focus on transitions has been not just sort of helping individuals and families navigate, individual specific issues and challenges, but stepping back and wondering and becoming increasingly concerned that we're missing a lot of folks who are aging out of the children's system, perhaps at age 21, aging out and not just falling off the cliff, as we say all the time, but falling off the grid because they don't know the supports and services that exist. They don't know how to access the Division on Developmental Disabilities. They don't know how to access the programs in the Division of Vocational Rehabilitation Services. They don't know how to access higher education or any of the many supports and programs that exist in New Jersey. We in our last annual report where we put out in July, we identify transitions as one of 6 of the priority issues that come to us on an almost daily basis. It's a persistent set of challenges because, again, for every individual and every family, the transition can be challenging. But for some folks that live in certain communities, it's even more so because they don't have the resources in their schools. They don't have they don't have a transition coordinator that can dedicate them enough time to the individual family. And our fear is that a lot of folks just really fall off the grid and they end up, without the supports and services that they need and deserve. And, that could be due to cultural barriers, language barriers, just lack of access to information. And so we really try to sort of fill that void to the extent we can. We know there's a lot of folks throughout the state that do. Span, you heard from. I know the ARC of New Jersey. I know a lot of my colleagues, the different departments do. But still, people fall through the cracks. And in fact, in the last report I just referenced, our last annual report, we tried to sort of quantify this a little bit. I mean, anecdotally, we know it and we sense it, but we tried to sort of quantify it by, looking at numbers from the Department of Education and looking at numbers from the Department of Human Services Division on Developmental Disabilities. And I would suggest anyone, recommend if you have the time to check out our annual reports, and we'd love to have a conversation about that because I think it's really an area that needs additional focus. Our recommendation in our office over the last couple of years is, that every classified student, every family that's involved in special education should be matched up with a caseworker or a support coordinator, perhaps at age 14 or 15, whatever the appropriate age is, just to be a resource for that individual family, to answer questions and to tell families, what kind of questions they should be asking. Because as we all know, we don't know what we don't know, right? So we need someone to sort of, show us, and tell us, check in with the family to be a resource. So that way, no matter what zip code you live in, you still have access to the services and supports and programs that exist for students and, so aging out of the system and becoming young adults. On our website, we have a lot of information on transitions. We try not to overwhelm you, but a lot of the information actually came from a webinar we did this summer, sort of facilitated by, or initiated by the governor's office. We, as well as colleagues of ours in the different departments, did a webinar to talk about in very plain language, what services and supports each of the departments provides, how to contact them, how to access them. We've housed all that information on our website, and I'm sure Amy or somebody can give you our website address. On that website also is a checklist, real basic checklist that we put together. It's not an exhaustive list, but it's just a starting point to have conversations for families. Again, when their student is 14, 15, you start thinking about some of these issues that we were talking about. Again, transitions are challenging and can be overwhelming for any individual, any family, but particularly that's true for folks with special needs. And so we, as well as our colleagues throughout state government and through the larger advocacy community, really want to do what we can to help facilitate that transition, to make it smooth, to make it successful. So with that, I'd love to open it up for any questions or comments. I'm glad to talk to you about anything. I would say, though, if you don't feel comfortable asking a question now or raising a question or making a comment, feel free to reach out to us directly, to my folks in my office, to me personally. Amy can give you my email address too. I would love to have one-on-one conversations with you and your families. So with that, I'd love to just open it up, see if anybody has anything.
Paul, it's Amy. I have put several of your resources you mentioned into the chat.
Right.
I also put your Facebook page because I know that's where you put most recent updated information. So everyone, I encourage you all to follow that website, the Facebook page rather, for the Ombudsman. I also wanted to note there's a newsroom page that's connected to all of the different articles that Paul has written over the years that you would find quite fascinating, including the majority of the annual reports, although I noticed the 2024 isn't yet on there, Paul, but the 2023 is.
Yeah,
And
the 2020, 2023 one is the last one because we did that about last year. So 2024 will be next year. We'll do that.
Oh, sorry.
Yeah.
Yes.
But yeah, I appreciate that. Yeah, we put all our reports up there, news articles. Actually, I just wrote another op-ed in recognition of October as Disability Employment Awareness Month. And I'd love to have a conversation about that. If I could just preview it for folks, because it's one of the issues that sort of I think about a lot, and I talk a lot with folks about. It's this notion of rehabilitation. Long story short, rehabilitation has been a key sort of concept in the disability rights journey over the last century or so. And the Rehabilitation Act, we all know, and a little bit, but rehabilitation, in my mind, suggests people are broken and need to be fixed. And while I think it's very well intentioned and there's a very strong, good history with rehabilitation, I think it's time now to, look at it as the other R word that needs to sort of be eliminated, replaced, and needs to take a fresh look at, what we talk about when we talk about disability employment planning and programs and services. So again, that'll be out soon. That'll be up on our website, and I'd really love to have a conversation about that.
You do have a couple of questions in the chat, Paul.
Sure.
One is there going to be consideration to lift the self-directed DDD budget cap for hourly pay? That's a great question.
Yeah, it is a great question. And it's one, as some of you may know, we write about in our annual reports every year. We feel, that right now there's been, since I think about spring of 2020, a cap, or effective cap, they'll say a threshold of $25 an hour that you can pay a self-directed employee. There are exceptions. Unfortunately, I think the exceptions are too limiting. The exceptions are, if not only for the needs of the individual, but if the self-directed employee has higher education credentials. Coming from a family, having a sister with developmental disabilities, I can tell you it didn't matter if the person caring for her had a PhD or not. Were they sensitive with my sister? Was she comfortable with them? Were they caring? Were they loving? So I think we need to sort of, continue that conversation, because there shouldn't be this arbitrary cap. And in other states, they don't necessarily have that.
Yeah.
So I think that's definitely a conversation that we need to carry forward.
Yeah, thank you. Next question is, what kinds of issues do families bring to you, and what kind of help do you provide to families? I know that would take days to talk about. They continue and say, I find families don't always know what your office can help with. Thank you.
Sure, I appreciate the question. We try to help with anything. I mean, we're very small. We have 5 full-time staff and one part-time staff person. We're small, but we're energetic and passionate and mission-driven, but we have limited bandwidth. And so, but we try to do our best in working with families on every issue. No issues too big, no issues too small. Again, whether it's getting you information, trying to help you get the information from a particular department, or, just trying to help you brainstorm and advocate, we're here regardless of the issue. I will say, though, maybe not surprisingly, but as the office has grown and sort of evolved over the 6+ years, more people come to us, with time-sensitive issues, and it's oftentimes in crisis. We deal with a lot of abuse and neglect in our office, in both the children's system as well as the adult system. We work, daily with folks that have autism and severe challenging behaviors. Again, children as well as adults who are not getting the supports and services that they need and deserve. And similarly, we work with a lot of individuals and families with very significant medical complexities. Again, children as well as adults. So that tends to be the focus of our work, because that's just who comes to us. But, whatever your issue, come to us. We'll try to help in any way we can.
Yeah. And I just want to shout you out, Paul, because I know firsthand I've heard from families that you have performed like what we would call miracles, where no one else or nowhere else was able to assist. The system sometimes has barriers and challenges, and you've been able to really help them overcome that to get the services and supports that families need, and more specifically, their loved ones that experience disabilities need. So you're a magic maker.
Thank you.
That's why I shout you out as the superhero.
Bless you. Thank you.
Feel free to call Paul when you don't know where to go. I'm sorry to say that, Paul, but you're
no,
out
it's true. And, and I appreciate that, and, again, we do have limited bandwidth, limited resources, but, we really feel, our focus, our lane, if you will, are intellectual and developmental disabilities. But if anybody comes to us with any other type of disability, we try to help to the extent we can. We know it's hard, and we know that, again, information is key. Information gives people agency, allows them to make decisions and to, good, bad, or otherwise. But so, yeah, I encourage you to reach out to us.
The next question I think is in reference to eligibility for services, right? So there's a cap that a person, to be qualified and eligible for DDD, for example, the Division of Developmental Disability Services, to have access to that budget. This question is, how about the limit of $2,000 in the bank? I heard it is going up to $10,000. Is that true, Paul?
Well, there have been efforts so there's Social Security, particularly supplemental security income, asset and income limitations. There's also limitations with respect to Medicaid, which is obviously required for DDD services and supports. There have been efforts, in Congress to sort of lift that and to revisit that. I will tell you, wearing my other hat, I'm on the President's Committee for people with intellectual disabilities. And we just put out our report yesterday, actually, our report. We met in Washington last week to finalize things, but we put out a report, and it addresses, it's about 40 pages, and it addresses everything from the workforce crisis, to employment, to housing. But I was able to co-lead in that committee, a subcommittee that looked at these federal programs, that looked at Medicaid, Medicare, Social Security, with an eye towards making recommendations to increase those asset limits, increase those income limits, and very importantly, eliminate the marriage penalty, which is sort of embedded in a lot of these programs, that prevents people with disabilities who rely on these programs from getting married for fear of losing those benefits. So there's a lot of work underway. Hopefully, there's a movie that was recently released, Patrice, the movie.
Yes.
I encourage everybody to go see it. And I think it's helping change the conversation. In fact, the Social Security Administration put out a statement earlier this week that they're on board with this notion of revisiting, the income and asset limits. So
Absolutely. I know you've had a big part in that, and I know that you are in Patrice, the movie. So thank you for that. Shout out. It's on Hulu. It was launched on the 30th of September. So you can stream it on Hulu. Not that I'm promoting Hulu, but the movie itself, called Patrice, the movie. Next question in the chat, and I'm gonna kind of paraphrase this for you to help clarify. So this is referencing reimbursement rates for DDD providers through a person's budget, right? As identified by the NJCAT, the New Jersey Comprehensive Assessment Tool, that determines how much a person can spend on services. This question is in regard to why is the reimbursement rate for a DDD provider higher than, let's say, a self-directed employee, because this person also asked that self-directed employee $25 cap question, but no cap on that provider's overhead percentage. So we know that's, the reimbursement rate would be, as a provider, if you're going through an agency, is more significant than if you're hiring your own support staff. And a lot of times that funding is used for overhead and administrative costs. And so do you have any insight as to why that might be, or if there's any anticipated change for that?
I could speculate as to why, but I will tell you, it's an excellent question, and it's a very important question, and it's something that we took a deep dive on in our most recent annual report. The second part of the report is entitled "Follow the Money," and we're looking at some of the systemic challenges that need to be addressed. And one is the money. I mean, there's a lot of money, we're very fortunate in New Jersey. The Governor Murphy, and the legislature have dedicated a lot of resources to serving people with intellectual and developmental disabilities. Our focus has been, and increasingly is, on how that money is being spent and not being spent. And that's in general. And then also to the question, the different rules, if you will, that apply for individuals and families versus agencies. We spent a lot of time in our report. I would, recommend or ask you to take a look at that report. We even put together a graph that shows some of the differences. Would love to have that conversation. I think it's something that needs to be addressed. I will say, some of you might have seen that Senator Vitale, who chairs the New Jersey Senate Health and Human Services Committee, this week announced that he's introducing a set of bills, some of which to look into to address abuse and neglect, and we're so grateful for that. But also to look at the financial management of some of these agencies. They didn't he didn't ask all of the questions that we've been asking, and as the person who asked the question today, but really I think his legislation will help start that conversation, because we need to look at the money. Sure, we know agencies sometimes have more overhead costs for some obvious reasons, but how much overhead costs, and why should there be different limitations placed on how much an individual family can pay their staff if they have the money in the budget versus an agency? It just doesn't seem right, and it doesn't seem like a workable approach.
Thank you. There is a comment in the chat clarifying from an audience member who has extensive experience with the disability community. His name is Walter Kalman. Hi, Walter.
Hey, Walter.
Walter indicates that the $2,000 is the asset limit for Medicaid needed for DDD changes, which we spoke about earlier. The $10,000 change is in Congress for amendment, so we need to advocate with our senator and congressperson, which you had mentioned, Paul. My question, adding to this comment, is your office able to, well, it's two parts. Is your office able to assist with advocacy with different state legislators? First part. And then the second part of the question is, being that you are a state appointed official, and also with the President Biden's administration for people with disabilities, and I'm sorry, I forget the full title of that committee. Is there an influence that you might have to assist people with making those changes in Congress?
Yeah, so I'll start with the second question, then go to the first one. I mean, conceivably, yes, we help folks, we can help with federal issues as well as state and local issues. We haven't had the bandwidth. I haven't had the opportunity to spend as much time. We do try to connect people with their congressional offices. We do have a relationship with some of the congressional offices. Some of them, send constituents our way, and we engage them in larger policy discussions. But we'll certainly help. On the state side, we're always connecting people with their state legislators. We're always encouraging that. Again, we really believe in our office that the most important voice is that of the individual families. And to the extent that they're comfortable doing so, we'll connect them. We'll connect them directly with the policymaker and the executive branch. We connect them with reporters. If they want to talk to reporters, we connect them with legislators. Again, we think, we want to do everything we can to sort of give a platform for individuals and families, because as we all know, no one knows better the challenges and opportunities and the people living, on the front lines, if you will, and we need to make sure that they're not only part of the conversation, but that they're actually driving the conversation. And so, yeah, we definitely try to connect people.
Oh, sorry, I was on mute. Thank you, Paul. While we're waiting for more questions to come in the chat and give folks a chance to think about them, can you share any stories without, naming names of your the people that you're offering services, supports, and really advocacy for? Can you share any success stories with us that you might recall, particularly as it relates to the transitioning process?
God, I'd have to think about it. What we try to do is we often, what happens in our office is we'll have a relationship with somebody. It'll be a one-time conversation, or we'll send them an email with some resources, or oftentimes, or more often than not, where it's an ongoing conversation. And we'll try to connect them, or we'll try to point them in the right direction, we'll give them advice, whatever, and then we don't hear from them. And we often take that as a good sign. I mean, that may not always be, maybe they've given up on us, right, everybody, but oftentimes it's a good sign. They got connected and then they moved forward. And so we don't really track, we've talked about this internally, sort of the success stories, because we're just really focused on just sort of the day-to-day grind. I'm sure, and if anyone in my office, we could probably put together a list of these, success stories. But when they do happen, when someone sends us an email that they got the placement, they got the job, they got this that they wanted, it really warms our heart, just because, as you can appreciate, I'm sure a lot of folks in this meeting can appreciate, these are hard. These are hard issues often. emotionally, I mean, financially for families and physically and all that, but emotionally it takes a toll on all of us involved. And to hear the success stories, and when someone circles back and says, "Oh yeah, I forgot to tell you, we got this," it means everything to us.
Yeah, I appreciate your candor about that, because I know what many people may not know, the role of the ombudsman is really to hear and listen and advocate for some of the worst situations that are happening in people's lives. So you day in and day out, you and your team don't necessarily get to hear about the successes and the positives. You guys are more dealing with the challenges. So April puts in the chat, no news can be good news.
Yeah.
And that's probably the case, yeah, with your day-to-day operations. Um, Paul, I'm sorry, I'm turning this into an interview. Is that okay if I ask you another
Fine.
question? What would you say would be the most important thing, advice-wise, that a person either going through the transition process, their family who is supporting their loved one and through the transition process, or maybe professionals on this live meeting and also watching the recording in the future, what is the most important thing that people should know? Like, if you take away one thing from this workshop, what do people need to know about transition?
I remember back in the days before I had this job when I was mayor of my town in Bergen County, and I'd work with a lot of the local families, and everybody would talk about the cliff, right? And even in a community like mine, which was well resourced, there was fear of the cliff. There was a fear that as you age out of 21, that it's no longer an entitlement. There are no federal and state laws guaranteeing supports and services for your loved one. One of the things I've learned, particularly since taking this job, is here in New Jersey, we are blessed because we do have a lot of resources that you don't need to fall off the cliff and you don't need to fall off the grid altogether. That we have programs, we have, for folks with developmental disability as well as other disabilities, and they just need to ask. It's a very complex system. You go on one website, it says one thing, you go on another website, it's another. The governor's office, to their credit, I will say, has recently, unveiled a sort of a one-stop hub, if you will, for the disability community. We've tried it on our website to make it a one-stop shop for folks with intellectual developmental disabilities. But the message I would tell people is, it's not hopeless. There are a lot of resources. There's a lot of good. There's a lot of hardworking, dedicated, thoughtful people, spending their livelihoods, trying to make the system better. You just need to ask. You need to go out there and you need to ask. And some of the best people to ask are other families. They know, again, from their own experiences, what works, what doesn't work, or at least what worked for them and doesn't work for them. So that would be my message. Know that there are resources, there are programs, there are good people wanting to help. You just need to find them. You need to reach out to them.
Thank you.
The other thing I would say, and that's sort of generally, specifically, a lot of families, and again, I know from being a parent myself, being a parent can be overwhelming, even under the best of conditions, whatever that means, just, people have resources and what have you. It's a lot. And, setting your children up for success going forward is a lot. And it's a lot of stress and it's a lot of worry. I will tell families, to start early. And again, it's hard. And this is why we have recommended a support coordinator or some type of, case manager, connect with every family when the child is 14 or 15, because they need to start asking these questions about, legal status, does guardianship make sense or not? Does supportive decision making make more sense? Maybe just power of attorney, maybe some kind of blend in the middle, having access to Medicaid at age 18 and Social Security. I mean, these are things we're not born knowing, and it's hard for families because they're overwhelmed. But they need to start asking questions earlier.
Yeah, great response. You mentioned in your response, Paul, that we're blessed to have a lot of resources. And I know sometimes it doesn't always feel like that, right? In New Jersey, it feels like there's not enough or there's gaps in service. But I just want to, commend the providers in the state and the state officials that have helped to put this system together, because New Jersey does have one of the more robust disability service systems in the country. And so that we are really fortunate to have that. And we're also, I put in the chat earlier while you were speaking, not every state has the luxury of an ombudsman. So we're also very fortunate to have you in service of our community as well. And just noting that you pointed out, connecting to other families, talking about what they've done to support their loved one in transition or what resources they might know about. I find that families that are connected to other families tend to be the most successful. There's, tends to be a burnout, feeling of overwhelm. Also, they can connect their loved ones to other family members' loved ones. And there are two resources off the top of my head for that. One is the Family Resource Network, and then the other one is the Regional Planning, Family Planning Support Councils, which are regional throughout our state and that are supported by the New Jersey Council on Developmental Disabilities, which is funded through the Administration for Community Living, like at the tippy top of the service providers in the federal government. So we're really, really lucky to have all of that and then some.
Absolutely, and those are two great resources, and I'd add a third to that, Moms to Mom, which is out of Rutgers Behavioral Health. It's a 24/7, hotline, support hotline for, and it used to be just for parents of children up to age 21, but now they've expanded beyond that. And they're a great resource, and the people answering the phone there are parents or family members who have had the experience and can point you in the right direction, at least share their experiences with you. So.
Thank you. I just thought of a fourth, the Community Living Education Project.
Yeah.
That's run by family members. They do an incredible job at all of the things they do. I can't think of one thing that they don't cover. And if they don't know it or don't provide it, they will find that answer for you and connect you to that resource.
Absolutely.
Any other questions for Paul?
Again, just suggest, urge people if they have any questions, big or small, to reach out to us. And again, we are small, so if we don't get back to you right away, just send us another email, ping us a little bit. We'll get back to you. But we're here for you. We're here to serve you, and in any way we possibly can.
Thank you. A question just came in. Is there any update on the services that DDD will now give students at age 18? I work at an inclusive higher education program. We accept students at age 18 plus, and we are looking for transportation and funding help.
Yeah, so DDD this year, really to its credit, and to the Assistant Commissioner Jonathan Siegfried, expanded DDD services to those 18, 19, and 20. Those that specifically are moving on to higher education or have a job in a competitive integrated environment sort of established or part of the plan. I don't have all the details, but it's a new development. I know they've been working with federal government CMS to make it possible. And this was born out of the recognition that, and it was, I remember there was one particular situation I was working on with the Assistant Commissioner going back a few years. A young man who wanted to graduate high school at age 18 with his peers, but he had developmental disability, and he was going to go on to a higher education program, but there were no supports then for him, and he sort of fell into a hole. And we worked together to provide some housing supports for him in the interim. But now for somebody in that position, they can early enroll into DDD if they meet some of those eligibility requirements. I think that's a real positive step in the right direction.
They followed up with saying that they were told that providing funding support would be available, but then that was rolled back to you.
If they want to reach out to me directly, I'd be more than happy to try to help figure out what's going on. Again, this is new, so maybe there's some kinks in it, but please reach out. I'll be more than happy to help you.
Thank you. There's thank yous in the chat. Someone also thanked you for your honesty before about how funding is spent with a person's budget. Paul has mentioned that he's available for contact. His email address, I did drop that in the chat, but I also want to acknowledge and let you guys know that Paul's going to be at April's Community Resource Fair coming up. April, do you want to tell us a little bit about that so we can meet Paul in person?
Absolutely. So in Camden County, I organize one of the largest resource fairs designed by a care management organization, and we'll have 200 resources under one roof on Thursday, October 10th, from 11 a.m. to 2 p.m. The venue is being held at the Collingswood Grand Ballroom, and there'll be resources for the entire community. It's 100% free. Doors are open to anyone who would like to attend. And Paul Aronsohn will be there. We'll also have a photo booth to capture the beautiful memories. And in addition to Paul, we will also have the DCF Commissioner, Christine Beyer, will be popping over as well. So it's very exciting. So if you're local in the area, you want to take a drive, come on down next week, Thursday, October 10th, between the hours of 11 and 2.
Awesome. We'll see you there.
Yeah, absolutely.
Great. Looking forward to it.
Yeah.
As always. Yeah.
Thank you, sir. Appreciate it.
And guys, April's being very humble. This is the largest social service resource fair in the entire state. Hundreds and hundreds and hundreds of providers. She just dropped the flyer in the chat, but people are asking, where is this held, April?
The Collingswood Grand Ballroom in Collingswood, New Jersey. The address is on the flyer. You can also like and follow the Camden CMO on Facebook, where we post things like this, but also a lot of other resources around the area. So yeah, definitely get connected.
And you mentioned the DCF Commissioner, Christine Beyer, in the interview with her. That's actually posted already on the YouTube channel. If you guys are interested in what the future vision is for transition from DCF, the Department of Children and Families, for the youth conference, and just transitioning in general, and other service providers, students, young adults, family members, that recording is on there, and I'm sure April's going to drop that in the chat in a moment. I can see that you're already looking for it.
I can drop it in there, no problems. Are there any other questions for Paul before we end the recording? This was fantastic.
Answered everything. Yeah.
You're a great guy.
No, we appreciate it. Really appreciate it.
Thank you so much, Paul. We truly appreciate your time and your expertise. And thank you to everyone in the audience for joining us and being a part of today's session. We hope that you learned something valuable and that you feel inspired on your own hero's journey. A lot of thank yous in the chat.